Health and Human Services. And our presenters today, let me introduce them to you. Our first is Melissa Adolphson. Melissa has over a decade of research and evaluation experience. She has worked on projects addressing substance abuse, mental health, suicide, juvenile justice, maternal and child health, and adverse childhood experiences. She holds a master's degree in population health sciences from the University of Wisconsin at Madison, and a bachelor's degree in women's studies from the University of Minnesota, Twin Cities. Kristen Dillon has been with Wilder Research since 2008. During this time, she has managed research and evaluation projects in a variety of human service areas. Specifically, she has provided leadership on several statewide demonstration projects in the areas of substance abuse prevention and recovery. Kristen also leads assessments and evaluations of the adult mental health system in Minnesota and beyond to identify opportunities for strengthening services and supports for individuals with serious mental illness. She has a master's degree and doctorate in family social science from the University of Minnesota. Both of our speakers, Melissa and Kristen, are from the Amherst H. Wilder Foundation, and I ask you to welcome them here. Thank you.
Thank you very much, Bev. And thank you everyone for the restaurant recommendations. I have a cousin in Baton Rouge, and seeing all those recommendations is making me realize I should go visit her. So today in this first webinar of the two-part series, we're going to be talking about the purpose and importance of the Caring Communities Youth Survey. We're going to share some methods that you can try to use to encourage schools to participate in the survey. And then more specifically, we'll provide some strategies for using existing CCYS data to help encourage buy-in and support for survey participation. And then we'll provide some tips and ideas for building a culture of data dissemination and excitement around data findings. Before we get started, we would love to have you answer this question in the chat box. And we'd like you to say very briefly why you're in the role that you're in as a prevention professional. Why do you care about prevention? What brings you to this work? You could just enter in the chat box why you do what you do, wanting to see kids have a fair chance at success in life. Wanting to serve others and make a difference, wanting to promote healthier lifestyles, contributing to improved outcomes, and making a difference in kids' lives. Great. Sharing and promoting prevention information in the community with youth and families, improving quality of life, promoting parent education and positive parenting. Working with different community sectors, promoting healthy lifestyles, building healthy community. So we're seeing over and over and over healthy communities, healthy youth, healthy families, and improved health outcomes. And so I think right there, you all have answered the question to our first section of this webinar, which is about why should we care about the youth survey? Why should we encourage participation? And the purpose really is to gather that information directly from the youth themselves about their health outcomes and their experiences. It's one great tool to use along with other data sources to see if all of the important prevention work we're doing is making a difference in the lives of the youth that we serve. So if we want to know what youth are experiencing and feeling in their homes, in their school, and in their communities, the best way for us to find out is to ask. And if we do ask youth about their experiences and perspectives, we really need to be prepared to use what they share and use their data to make a difference. I know that's one thing we've heard in some communities. Youth participate in this relatively long survey on a number of topics. And when they return the next academic year, they want to know what changed as a result of them taking the time to complete that survey. So it's really important to elevate and honor the voices of our youth. The CCYS is one valuable data source to help guide assessment and drive planning. And importantly, it covers a really wide range of topics. So not only substance use, but also really salient risk and protective factors that contribute to substance use. And this allows state partners to analyze the results and show associations between substance use and other factors to identify which of those risk and protective factors are most salient and most important to address. And we know that that can differ by demographic group. So while local level CCYS data may not be easily accessible by demographic, coalitions in the state can review the data by race, ethnicity, the profile reports that are produced by Bach Harrison to identify some state level disparities that would be applicable for the populations that are most prevalent in their communities. We can use tools like school enrollment data and the American Community Survey to figure out which of those populations we have in our communities if we don't already know, and then look to the state level data to identify those disparities. Community coalitions, youth serving organizations, and other community stakeholder groups rely on these local data to secure funding and other resources. So the CCYS importantly provides current data that's local, trend data, and standardized indicators that are consistent from school to school and parish to parish, unlike more customized grassroots local surveys and focus groups where we don't have that state level and regional comparison. And then further, a state funded survey is really an invaluable resource. Communities often don't have the funds and resources to conduct such an extensive survey on their own. Including the costs associated with survey design, creating the protocols, cleaning the data, analyzing it, and then producing the reports from the analysis. So it's really a wonderful resource that communities don't have to invest the funds in. It's more about investing the time in promoting that survey. And then once communities do receive funding, CCYS data are often needed in order to meet those funders' reporting requirements and work to evaluate change over time to see if we're having successes. The past couple of years have really exacerbated stresses for students and youth. And the CCYS will be one valuable tool that can help shed light on how societal and environmental factors impact youth and their mental health, their substance use, and their academic engagement. So for the communities that use the CCYS data to evaluate their programmatic outcomes, we may in fact see some worsening trends in substance misuse that result from the stress from these societal and environmental factors. So I think more than ever at this time in history, these survey data are going to be really important for ensuring that we're meeting the health needs of our youth and families. I just wanted to share a little bit of information about who's working behind the scenes to make the CCYS happen. And I apologize for my Minnesota accent, but the Peak Art Center plays a really pivotal role in recruiting schools, really serving as that state level champion for participation in the survey, providing more background information about what the survey is and why it's important to participate, working with each school to obtain their survey sample, and then making sure the schools get everything they need in that survey packet, the surveys themselves, the protocols, And then also making sure that the resulting reports that are produced are accessible online. Bach Harrison also plays a key role in data cleaning and analysis. Again, those things that are often very costly if that onus is put on the communities themselves. Local level reporting, producing those important reports by race ethnicity for identifying disparities, and then providing ongoing training on data interpretation and response rates. And while the Peak Arts Center is a champion for promoting the survey, everyone can play a role. And it is super vital to have champions at the local level. So those people who can leverage relationships, either with decision makers or influencers who can influence the decision makers. And the state and their vendors may have more of an outsider status, and so may not have those relationships that they can really leverage. So find out how you can turn into support the school by helping them once they do participate in the survey. Can you play a role in helping them disseminate their data, help them with data-driven planning and decision-making, and then also help them use the data to justify need for additional resources and supports, both for the school and the broader community, to help ensure that we have resources to keep kiddos and families healthy and safe. And also providing some positive pressure, stressing the importance of why the data are needed for your programs and initiatives, and what the ramifications would be for your program or coalition if you didn't have that data in a particular year. Right. So next, we're going to talk about some specific strategies that you can use to promote participation in the CCYS. So we're going to walk through each of these steps, but one is first identifying who the key stakeholders are, who cares about the data, who can have an influence on schools' decisions about whether or not to participate, who uses the data once it's available. Identifying those champions, which could include you, who will really help promote participation in the survey. Sharing the successes, like what have you been able to do with the data? What are the positive changes for youth and families and the broader community because of the survey data? And then also addressing any concerns that school districts and community members and parents might have about participation in the survey. So in terms of key stakeholders, consider all school staff. So if school administrators are on the fence about participating, it could be the case that identifying counselors and teachers who are champions, they could play a critical role in advocating among admin for survey participation. You may have youth groups who have used the data for youth-driven messaging about topics that are important to them, and really elevating that youth voice again and having them serve as champions as well. Youth serving organizations who rely on the data to secure funding and meet reporting requirements to serve youth and families. And if you're approaching them to be a partner and putting that positive pressure on the school, it can help if you're not as familiar with that organization to just do a little stalking on their website or read their annual report to learn a bit more about what their priorities are, what activities they're implementing, and how the data could be potentially important to them. Also, local governments often rely on these data to secure state funding for services. And parents too can be key influencers, whether they're in support of the survey or against the survey. So it can be important to kind of take the pulse of parents and see if they're appreciative of the supports and resources that are the result of the data being collected, or if perhaps they have some major concerns about the sensitivity of the survey questions, and maybe they're applying some negative pressure on school administration for participation. And so at this time, we'd love to hear from you about who else you identify as key stakeholders when it comes to encouraging buy-in and support for survey participation. Who's not listed on this slide? Bus drivers. I love that idea. They're the first individuals to see many of the kiddos at the beginning of the school day. And I've heard so many stories from communities where bus drivers like could say, oh, this kiddo had a bad night, we need to help them. And just, greeting them by name and knowing, what's happening in their lives. First responders, that's another great one in any way, shape, or form. Similar to the bus drivers, they can see what the youth are experiencing in their homes and in their community. Planning boards, LEAs, local governments, all are reliant on knowing what's happening with kids and families and how they can best support them. Faith-based organizations, I think, could be really helpful in talking with the importance to families and parents and caregivers about how the data can be helpful. Custodial workers, that's another great one, like bus drivers. They sometimes have that kind of on the ground interaction with kids that teachers and administrators don't always have, and can sometimes build some unique friendships and relationships with youth. Hospital administrators, definitely similar to first responders. They're seeing some of the things that kids are dealing with and their families in the community. Thank you for sharing all of those. And during the second webinar, when we talk about a communications plan, these are some of the important stakeholders that we'll want to think about. So finding those core champions for promoting the survey, identifying those people who really get it and understand the importance of the data and why it's needed. Also, finding those people who do rely on the data to secure funds through grants and other modes to really and use those funds to implement strategies and measure successes and change over time. Also, finding those individuals who value that youth voice and want to help elevate it, and also youth who are champions. In some of the communities I work with in Minnesota, we always take care to present the survey findings back to the youth and identify ways that they want to be involved in using that data to inform planning or raise awareness of issues that are important to them. And then also finding those champions who are really appreciative of having that local level data. It's one thing to have state level data from some of the national surveys like the Youth Risk Behavior Surveillance System, but we often hear in communities, well, that's not our kiddos. That's not Baton Rouge youth. That's other youth in Louisiana. So the more local that we can drill down, the better. And the more champions that we can have in each community to help promote the survey, the better. So steps that you would want to take to encourage participation in the survey, or steps to share with your local champions, is first asking if they plan to participate in the survey. Maybe they all already see the value and appreciate it. And if they say, yes, absolutely, we plan to participate in the survey, thank them for doing that. Thank them and let them know how much you appreciate it and why the data are important to you. If your school is unsure if they want to participate in the survey or are feeling pretty strongly that they don't want to, that's where we can take some steps that we'll be talking through today to encourage them to participate and share successes and share examples of how the data have been used, but then also identifying the concerns and barriers that they're sharing and having talking points in your back pocket for addressing those concerns and barriers. So sharing success stories. Did your community use the data, for example, to secure a drug-free community grant? Did your community use the data to develop new programs or activities for youth and families as a result of what you learned from the survey findings? Thinking about what have been the ripple effects of sharing and using your CCYS data. Were there some unintended positive impacts that were indirectly related to your efforts? And have the data led to an increase in community awareness around a particular issue like vaping or youth violence? So we're going to go into more detail on this in the second webinar, but it can be super helpful to create promotional handouts so that they're not only hearing your voice or the voice of your champions, but they also have something that they can hold in their hands and take back with them, read later, and share with other decision makers and stakeholders. So consider including things like coalition logo, maybe a photo or image of a strategy that you've implemented with youth and families, 1 or 2 trend charts showing some of the improvements that you've seen over time based on the implementation of the prevention activities. Are you seeing rates of youth alcohol use go down over time, for example? But then also sharing some ongoing concerns. So maybe celebrate a success and a concern. While we're seeing alcohol use rates go up or go down, we're seeing higher rates of anxiety and depression that we're concerned about. So making sure that the data are relevant and kind of a call to action. And then very briefly celebrating 1 or 2 success stories of how the data have been used. So now I'm going to turn it over to Kristen Dillon, who's going to talk about how to address concerns.
Thanks, Melissa. So we want to acknowledge that community members often do raise concerns about student surveys, such as the Communities Caring for Youth. And we have dealt with a lot of the same concerns that you may be dealing with. So we're going to talk today about 4 of the common ones that we frequently hear here in Minnesota, which are response rate, reliability of the survey, asking youth sensitive questions, and dealing with survey fatigue that youth might be experiencing. So the first one that we're going to talk about today is response rate. And I know that this is something that you have been talking about previously with both Bach Harrison and the P-Card group. So just to get us all on the same page, when we're talking about the response rates, it's really the number of people who responded divided by the number of people who are eligible. And one thing that I want to note is that there is a response rate handout, and it looks like it was just posted in the chat. So that includes more detail than what I'm going to describe today, but a lot of the same points that I'm going to talk about today are included in that handout. So you don't need to jot notes or anything like that. You'll have all of the information right there. And that includes this definition. So when we talk about what makes a good response rate, I know that some of the guidance that you've been given in the past is that you're really aiming for 60% of students responding to the survey. And if it's below 60% of students, the response rate isn't very good. Well, we want to broaden that a little bit and think critically about what does constitute a good response rate based on how you're planning to use the data. So it's a little bit different than just throwing out one number that cuts across all of the uses. So the first factor that we really want you to think critically about is how closely does the group who responded represent the overall population? So this is one of the most important questions to consider when you're thinking about response rates. You can have a really high response rate and yet miss an important group of students, particularly if there's a group of students that weren't engaged in the survey or weren't present in school the day that you administered the survey. Or you can have a low response rate that really closely represents student characteristics, and that might actually be a stronger image of what students across your school or your district believe. By answering this question about how closely the group who responded to the survey represents the overall population, you're going to be able to determine which parts of your population are represented in the data, which ones are not, and it'll help you be more transparent in your messaging. So when you put messages out into the community, you can be very clear about what those messages mean and who they pertain to. The next question that we want you to consider is how you will be using the data. So there's a lot of ways that you can use data, and there's a lot of flexibility in what you can do with it. And if you're using the data to do something like identify whether or not a phenomenon is present in your community, such as whether or not bullying is an issue in your schools, the response rate is a little bit less important for answering that question. Even if you have a smaller group of students responding to the survey, you can still tell whether or not bullying is happening from those that did respond. On the other hand, if you're trying to identify a specific rate of underage alcohol use in your community, for instance, then the response rate, along with other questions that you'll see on the screen, will be really important to consider to understand how closely that prevalence rate of underage alcohol use actually does reflect what students are doing in your student population. And a lower response rate can be associated with a larger margin of error. And we're not going to necessarily get into exactly what a margin of error is or how it's calculated, but it's important to know that if you have a lower response rate, you do need to be more careful in your statements about the data, including being very clear, again, about who is and who isn't included and what the data represent. The next question that we want you to consider is how consistent your response rate is over time. So if you're planning to look at data over time, and that's actually one of the really lovely benefits of using the CCYS, is that you do have multiple time points potentially for a lot of the schools or districts or parishes that you're working with. If you're planning to do that view over time, it's important to consider how comparable those students are over time. So again, looking at those demographic breakdowns, looking at the number of students that participated, looking at whether the students participated in a different way, such as online versus paper, will be important for you to understand whether you are comparing apples to apples. If your response rate goes up or down drastically, that might be a sign that you are not comparing apples to apples and that you do need to determine whether it is the same representation across multiple waves of the survey or not. And if not, you may need to look at specific groups in your data over time, such as if you have really steady representation from 8th graders year to year, but you don't have steady representation from 11th graders, then you may have to look at 8th graders over time to look at some trends. The last question that we want to encourage you to consider when you're thinking about what constitutes a good response rate is how easy it is to detect the issue you're measuring. So this is something that you may have to rely on other data sources to know, or you may have a general sense. But if you're trying to measure a phenomenon that's relatively rare, such as use of cocaine among students, it's really important that you have enough respondents to determine whether or not there's actually a pattern of use versus just 1 or 2 individuals reporting use in a given year. That will greatly change what you can say about the data and how meaningful that data is. This is even more important if you're hoping to disaggregate the data in some way, such as by grade or by gender or by school, or if you're trying to look at small changes over time. So if you're trying to look at changes in cocaine use over time, it's really important to know that you have enough students in your sample to understand whether or not there actually are changes versus just 1 or 2 students changing their behavior or changing what they're reporting. If you have a phenomenon that's more common, such as drinking Coke, then the likelihood of that error of chance affecting the proportion of students in your specific survey who say that they drink Coke is relatively low. So this question is less of a concern for you. So this is another thing that you have to think about when you're considering what a good response rate is. So after you've considered those questions, you may find yourself in a position where you don't feel completely satisfied with your response rate, given how you're planning to use the data. So some of the key suggestions that we have for you are to first know that you're in good company. Across the United States, response rates to surveys have been declining over the last 20 years. And there's research to show that that cuts across all different types of surveys that are going out. So it includes large federal mailed surveys, phone surveys, it includes local surveys. And in that response rate handout, there is a citation that you can look at if you're interested in digging in more to this finding. So once you recognize that you're in good company, some of the things that you can do about it are, first of all, be upfront about the limitations to your survey. It's important to identify and be clear about what your response rate actually is. And again, who was and wasn't included in that response rate. That increases your credibility, and it also makes sure that anybody using the data that you put out there is using it responsibly. You can report what you feel confident reporting on. So, if you feel that you can confidently report results for middle school students, but not high school students, then share what you can about middle school students. There's still probably a lot of rich information to be had there. Or if you are able to more confidently report themes, such as students are more likely to use alcohol than marijuana or something like that, rather than precise numbers, that can still be really informative and very useful and impactful in your community. or like, for instance, if you could say that male respondents tend to drink more frequently than female respondents, even if you can't report the specific percentages of male respondents and female respondents or how frequently they drink, it can still be useful, and you can still tailor your marketing messaging and strategies to addressing that issue. And then finally, sorry, consider weighting the data. So that's a more sophisticated analysis technique. But if you have access to somebody in your community or at the state who is able to do that more sophisticated analysis, it is an option that you can use to help even out your data. And then finally, look at other data that you have access to, such as school disciplinary records, local law enforcement data, healthcare data, qualitative data, if you have interview data or focus group data, and compare that to your student survey data to try to tell a story. And that can help fill in some of the gaps. It can help verify or justify some of the findings that you had in your survey. And then, of course, try to boost the response rate next time. And we're going to talk a little bit about ways to do that a little bit later in this presentation. So another issue that we frequently hear in Minnesota is that community members don't necessarily trust self-report data from students. They don't necessarily believe that students are telling the truth or that the results are reliable. And when we talk about reliability, we're really talking about the consistency in measurement and results across multiple times that it's administered. So thinking about weighing this watermelon, if you weigh it over and over and over again, hopefully the weight is the same if the scales are reliable. So when we deal with this question, we often point to a few different ways to think about whether you can trust self-report data. So one of them is that the communities caring for youth survey is anonymous, and that's been shown to increase respondents' comfort answering honestly. If a student understands that the survey is anonymous, that it can't be linked back to them, it can't be tracked back to them for their teachers, their peers, their families, then they are generally much more comfortable reporting what's actually happening in their lives. There's less social stigma, there's less bias in what they're reporting. And so there's a robust amount of literature that speaks to how that can really help students be more comfortable reporting honestly. In addition, data cleaning. So we know that the CCYS goes through a great deal of data cleaning before the results get to you. And so that includes comparing whether there are inconsistencies in the data that a certain student reports. Like if a student says that they drank alcohol in one question and then later on say that they never drank alcohol, that's an inconsistency that's flagged for cleaning. Also, cleaning involves identifying improbable answers. So if a student says that they drank 40 days in the last month, that would be flagged as an inconsistency or something that's an error. And so those types of flags end up being reconciled using concrete rules, and sometimes that data is excluded if there's not another way to address it. And so through this really rigorous data cleaning process, the data ends up weeding out responses that do not make sense or are unlikely to be true. So the results that you end up getting have already gone through this process of validation before you even receive them. In addition, the majority of students exhibit patterns of responses. And so part of data cleaning is identifying whether those patterns are reasonable and consistent across similar questions. For instance, if there's a student that is not engaged in any after school or out of school activities, that there would be consistencies in how they're answering any questions about their time out of school versus a student that flags that they are engaged in a number of different activities and there's patterns in how they're spending their time out of school. And so looking at those patterns, research has also shown that students tend to be consistent in their answers, and they tend to show, those patterns tend to hold across different students and across different characteristics of students. In addition, as results have demonstrated, percentages for many answers are consistent over time. So not only are they consistent within students, consistent between students, but also consistent over time. And so similarities are likely to only occur if students respond in a way that is reflective of actual perceptions or actual behaviors versus students systematically lying or making things up on a survey year after year after year, especially given that you generally have different cohorts of students over time that are responding to the survey. So that's another way that we can validate that the survey results are probably accurate. And then survey findings are often consistent with findings in other similar states or national trends. And so that's another way that you can validate whether your results seem to make sense, if they seem probable, logical, and if they're in line with what you would expect to see. And then, and so this whole combination of individual response patterns, plausible relationships among answers, consistency over time within your state, within your parishes, and consistency with other research and national studies all attest to the overall credibility of student responses, both in your survey and across student surveys throughout the country. Okay, another challenge that we often hear about, and there's been news stories about, are the dangers of asking students sensitive questions. And so when we're talking about sensitive questions, we're talking about things like asking students about illegal behaviors, anything that poses a risk to them if disclosed, anything that may cause some social stigma, outing a person for an identity that they haven't outed themselves for, anything that poses an invasion of privacy, things that might be emotionally upsetting, and then questions with socially desirable responses. So one of the things that we often hear is that asking students sensitive questions can lead to students doing a behavior or can lead to students being traumatized by the questionnaires. Well, when we look at research about this phenomenon, we actually see that generally respondents perceive more benefits to participating in studies that ask sensitive questions than distress from that participation. Specifically, they tend to identify value in sharing their experiences, disclosing something that might benefit or help other people, and contributing to a larger purpose. And so this is particularly important if you do make use of data that can help demonstrate to students that they're answering openly and honestly does make a difference, and it's worthwhile for them to do that, even if they do experience some mild distress in doing it. We also see that just because we don't know about a behavior, it doesn't mean that the behavior is not happening. So we can better address issues and support students if we understand their worlds and their realities. There is a lot of evidence to support the idea that asking a student a question on a survey does not lead to them doing a behavior. Indeed, it just leads to you knowing that they're doing that behavior so that you can better support and address it. There are also studies that show that the majority of study participants identify that daily stress, so just the stress of going to school, taking exams, being in a social community, that those tend to be greater than any stress from a study, even if the questions are very sensitive. And this has actually been found even among populations that have experienced deep trauma and are being asked about that trauma. And so given that the questions on your student survey, yes, they are sensitive in nature, but they are not necessarily all focused on a traumatic experience. And so the level of stress elicited by those questions is probably even milder than what this particular study had seen. And then finally, in a 2014 study, specifically looking at how long it took for a person to recover after experiencing distress while participating in a study, the majority of respondents did not reach a high level of distress during the study at all. And again, they were asked very, very intensive questions about traumatic episodes in their lives. And of those who did experience some level of distress, most reported that they recovered immediately after finishing their participation. And those that didn't recover immediately, they recovered within an hour or two. So again, those are asking questions that are much more sensitive than what's included on the CCYS. But we wanted to offer this as an example to show that even if a student does feel stressed out by answering questions, or even if the questions do feel really sensitive in nature, it is unlikely that those questions are going to negatively affect a student in any lasting way. And again, we can provide references to the studies that I mentioned if you're interested. So if community members, parents, school staff raise this concern to you, there's a few ways that you can buffer the effects of sensitive questions in your survey. So one of the really important ones is to obtain parental consent. If parents know that you are going to be asking students questions, if they have an opportunity to understand why you're asking it, what's being asked of the students, what their participation entails, that the survey is anonymous, how you will keep the results confidential, that can help really ease a lot of their concerns and make them feel like they had a choice in the matter. So it's really important to obtain parental consent. So here in Minnesota, we use passive parental consent, and parents can opt out of their students participating, and that's completely valid. I think the important thing here is that parents know what's going on so they're not surprised. Another way to buffer the effects of sensitive questions is to make sure that you explain the purpose of those sensitive questions to students and to other stakeholders. So you're not asking questions just to dig into the personal lives of students. You're asking these questions so that you can inform practices, strategies, supports, services for students so that they can be more successful. And it's really important that people understand why you're asking these questions and what you're planning to do with the information. We say that all data collection has a voluntary component to it. And so it's important that students are able to skip questions that they don't feel comfortable answering, questions that may be triggering to them. And then there has been research to show that if you have a positive or neutral even activity after the survey, that can be a buffering effect. So, if students complete their survey and then they're able to have some social time, or they're able to do an activity in class that is a little bit more fun, like a game, or even if they just go back to regular schoolwork, that can be a beneficial way for them to switch gears, reset their minds, and get back into the groove of their day. And then also, because there are some students that may experience some distress from the survey, it is helpful to have resources available to students, someone that they can talk to if they are experiencing distress, somewhere that they can go if they need additional support. And so by providing those resources, you can better protect students, and you can tell parents and stakeholders that you have those supports in place for students just in case anything were to happen. And that can ease a lot of concerns as well. So the last challenge that we're going to talk about today is that we often hear of survey fatigue when we're approaching schools to implement a student survey. And so survey fatigue is when your audience becomes bored or uninterested in your surveys. They may not want to do them. They may not do a good job filling them out, and may skip a lot of questions. And this really comes down to asking too many surveys or asking too long of surveys. So there are some strategies that you can use to address this. We know that you may or may not have flexibility in the actual length of the student survey in your state. So certainly that is one way that you can address this issue, but maybe you don't have that flexibility. So some other ways you could do it is to strive to streamline surveys in schools in general. So if a school is hoping to collect a survey about school climate, or if they're hoping to collect a survey about school or student health, you can make sure that what they're hoping to ask about is included in your survey, and hopefully you can find ways to use the data from your survey to address multiple needs and concerns, so that a whole bunch of different surveys don't need to happen to get at all of these different goals. Also keeping in mind that when we talk about surveys for students in particular, there can be a similar feeling between a survey and an exam. It's this time where you're really focused, answering a bunch of questions. And so one of the things to really consider is make sure that the timing of your survey makes sense for what students are already experiencing, including any standardized testing or finals, any other large survey or exam periods of time. And then it's always helpful to try to make students excited about participating. So we're going to talk about that a little bit later in these slides, but making the student survey something that's considered positive and that they're a way for them to their school or their community can really energize students and help overcome any survey fatigue that they may be feeling. So thinking about all of these concerns that may come up in your community, we encourage you to, before you start going out and having conversations with stakeholders about administering the CCYS, we encourage you to develop some talking points that are tailored to your community to address whatever concerns you're hearing. One of the things that's really important about this is that we want to make sure that you do tailor those talking points to your community so that you're not bringing forth concerns that people don't have. That we have seen that before, and it's something you want to avoid. You really want to focus on the ones that are relevant to your specific community. And so one of the strategies that has been successful here is creating a frequently asked questions handout that addresses each of the concerns that we covered or any others that are relevant to your community. And Melissa's going to share an example of a frequently asked questions document that we've used in Minnesota that you could use as the basis for your customized tailored document. And then also it's just helpful to be ready with responses to address concerns when meeting face-to-face with decision makers and presenting findings. If you perceive in advance what some of the pushback may be, it'll help you feel better prepared to address those concerns, and it'll hopefully give you the resources to be that credible, positive representative of this data in your community. And again, I want to refer you to the response rate handout as one of the resources that you can use when you're formulating these talking points. Now I'm going to hand it back to Melissa.
Thanks, Kristen. So we've shared some examples of strategies that you can use to promote participation in the survey and build buy-in from key stakeholders. And now we're going to talk specifically about how you can use your existing CCYS data to make those plugs for survey participation. So one thing that can be helpful to do is to connect the dots between substance use and other community and stakeholder priorities. One thing that we've had a lot of success with here in Minnesota is that our communities from every corner of the state are just energized about addressing adverse childhood experiences, the measures of childhood trauma and neglect and family dysfunction. And so we've had a lot of success even in with community stakeholders who weren't necessarily excited about talking about alcohol and marijuana, by showing them the association between those two. So how much more likely youth with high ACE scores are to report use of alcohol and marijuana. So it can really help to find out what do your school stakeholders really care about. If they're caring about educational engagements, academic outcomes like self-reported usual grades, being able to pair that data to show that there is a link between what you're passionate about working on, whether that's substance use or mental health, and what your stakeholders are passionate about. One way to do that is by analyzing the data. What's so lovely about a survey like the CCYS is that it does cover so many topics. So if you have the support of an evaluator or researcher who can run some crosstabs and show that strength of association between what you care about and what your stakeholders care about, that's a great way to do it. So for example, youth with 4 or more ACEs are 3 times more likely to report past month alcohol use compared to youth with a lower ACE score. It can really help show why they should care about what you care about and vice versa. If you don't have that ability to analyze the data or access to an evaluator, another way you can do that is just look at the research literature that points to those connections between, for example, bullying and vaping. So if you have the research showing that there is an association between those two, And then you can pair that with your own local data on vaping and bullying to kind of help paint the picture and tell that story. It can also be helpful, I know I mentioned this earlier, to help your local school districts share the data, creating fact sheets, putting together presentations, and sharing the data more broadly with the community. And that's where it's going to be really important to build those trusting relationships with your school administration and staff to figure out what they're comfortable sharing with the broader community, and what you want the context of those messages to be. Also, use the data to celebrate successful changes that you've achieved through your prevention efforts. Share your data and information with influencers and decision makers in a user-friendly and bite-sized way. You're more likely to get them to read what you're sharing or listen to what you have to say if you're providing that information in small doses. And it also provides them with an example of how you can then share the data if they choose to participate in the survey after hearing your arguments with the broader community in more bite-sized pieces that are action-oriented. So here's one example of how you might use your existing CCYS data to help promote participation in the survey. Let's say that your local data showed that past 30-day e-cigarette or vaping use tripled among 10th and 12th graders and doubled among 8th graders from 2016 to 2018. And this is something that your coalition found particularly alarming. Then what was the success of using that data? Maybe your local coalition added vaping as a priority that they wanted to address along with alcohol and marijuana use. It could be the case too that you were able to use that CCYS data on use to write for and get awarded a drug-free community grant. Once you've been awarded that drug-free community grant and added vaping as a priority to your coalition, it's going to be important to continue to encourage and promote participation in the survey in future years so that you can meet the federal reporting requirements for that grant. In addition to meeting reporting requirements, you also want to be able to have a way to measure decreases in vaping over time that may have resulted from adding curriculum on vaping risks to schools, providing cessation programs for youth who are caught violating a school vaping policy, and perhaps doing educational compliance checks with tobacco retailers in the community. So how are you going to know that these prevention efforts have been successful if you don't have ongoing data and trends to show how vaping rates have been impacted over time? As a second example, perhaps your data show increasing rates of youth depression over time and higher rates of suicidal ideation among youth in your community as compared to the state average. So you might be able to take and use these concerning data about depression and suicidal ideation to make some changes and steps in your community. So one example might be identifying youth champions who really identified depression and suicidal ideation as something that they care passionately about, that might lead them to establish a support group to provide peer supports for other youth who are struggling with depression. Using these data and sharing it with school administrators and community mental health providers could lead to a step of getting school staff and teachers trained in something like mental health first aid or question, persuade, refer to support kids who are experiencing suicidal ideation. So we've talked about strategies that do involve using existing data and then more general strategies that don't involve existing data. And now we'd like to hear from you. Have you tried any of the strategies that Kristen and I shared? And if yes, what did you try and what kind of success did you have? And feel free to enter a strategy that you've tried that Kristen and I didn't mention. We're always eager to learn about new approaches that could be taken to promote survey participation. All right, multimedia campaigns using the data. I think the more you share your CCYS findings through multiple channels and with multiple audiences, the more excitement you can build about the importance of the data and how it can be used. We'll be digging into that a lot more during the second webinar.
This is Felisa. We've tried looking at the questions that we have on the survey to see where we can shorten the survey so that the length of the survey will be less than, won't require any more than a class period. We've also tried using the storytelling infographics as far as the data for CCYS for the local LGEs. We've also made sure that we've tried to make it a public document so that the parents have access to it to be able to view the actual survey that's being implemented. I'm
Great,
sorry. I thought I had started my video as well when I unmuted myself. I'm trying to think of what else we have implemented. We have the passive consent from the parents. And we've tried to, Dr. Ray Bigger with University of Louisiana at Lafayette and his staff, they've made themselves available to go to the school districts, the different parishes, and provide presentations or answer any questions that they may have. So we've tried a variety, some of the strategies that you all mentioned, as well as other strategies.
Thank you, Felicia. And I see that some folks have shared data when providing presentations on local youth coalitions. And then also engaging youth in sharing the data. I definitely find that this is very effective. Oftentimes community stakeholders would rather hear from the youth than some of us old folks who have been talking about prevention for years and years. So that's a great idea of having radio PSAs that are really going to reach a lot more people than potentially an infographic on one organization's website. So thank you. These are some great examples. So now we want to transition and talk a bit more, and I know we have been along the way, about creating a culture of data dissemination and use, and really celebrating our data and getting excited about it. So I know whenever I'm delivering a presentation or a training that uses any use survey data, I thank the participants in the audience for any role they might have played, whether or not they persuaded their school administration to participate, or they served as a champion, or they tried to build excitement and encouragement about the survey participation. I also really express excitement about the next round of data that we might get when I'm presenting data and trends, to get people excited and encouraged about additional trend data that will help us continue to share a story. Another thing that we've done often is pair our data with a specific action step or resource. So one way that we've done that in Minnesota is we developed something called What's the Data Point? And it was a monthly email blast that came out through our Prevention Resource Center, where we would share one single statistic. It wouldn't be a flood, it would be one large icon with a percentage in it, or one trend chart. And we would pair that with a resource or a tool, and then an action step that could be taken. And the way we identified topics each month, one was like doing things like aligning with an awareness month. So when it was Mental Health Awareness Month, we provided one data point on youth anxiety, and then one online resource that schools could use to help students address anxiety. Another way that we would identify topics would be when a new resource was promoted. So as one example, an organization came out with a toolkit for employers on addressing opioid misuse. And so we shared, in that case, data on adults' opioid misuse and overdose, and then paired that with the toolkit for employers. So making sure that the data are shared on a regular ongoing basis and that they're timely and they're paired with an action step to make sure the data are actionable. And then also using fun and innovative approaches to sharing data that really engage people. And this is something that we're going to talk about a lot more in the next webinar and actually dive into creating a dissemination plan. But when you're thinking about how to get the data out there to various stakeholders, figuring out who those audiences are, and then identifying what they want to know. What are the key messages that you want to share with each of those audiences, whether it's the importance of participating in the survey or sharing data back with them. And then figuring out the best method for delivering those messages, whether that's just having some talking points in your back pocket and sitting down over a cup of coffee, sharing a one-pager, or using some of the more fun and engaging methods that we're going to talk about in a minute. And then figuring out who's going to share that message. It might not be the person who created the infographic who's the right one to sit down with a superintendent and share the information and encourage them to participate. So this is really where you're going to lean on those champions and the people who have the relationships who can really engage. And then another key importance of a communications plan is just figuring out the timeline. And this is really important when we're talking about a communication plan to encourage participation in the survey and really walking backwards from when the survey needs to happen and figuring out when you need to talk with those champions and key decision makers. So there's a handout too that we'll be putting in the chat that provides a little bit more information on some of these more innovative approaches. And so really a long report can be a real slog for people who don't love wading through lots of data. Infographics and fact sheets are great, but it really takes some graphic design savvy to pull the reader in and keep them engaged. So it can be helpful to find ways to enable people to like dig in and interact with the data and keep them engaged in the process. And using more interactive approaches also can help increase retention for the end user. It helps them maintain that knowledge change and awareness about the data. So one example is a data party. I probably should have put this at the end of the list because a data party often involves gallery walks and placemats and fun games. But this is a way to bring stakeholders together. And rather than a boring PowerPoint like you're getting today, or handing out a long report and hoping that people read it before they come to your meeting, are there ways that you can have games and activities that really get people talking to each other about the data and what the data mean and say? So one example is a gallery walk where you can hang data around the room and encourage people to get up and get their blood moving and walk around the room and talk to each other. And these could be fancier posters sharing data, or they could just be large white sticky sheets with large percentages written on them from your local data. It doesn't have to be too fancy or involved. Another thing that you can do, whether it's at a data party or at a meeting where you're sharing a meal or even a cup of coffee, is putting together a data placemat. So that's really similar to an infographic, but it's something that you can have at each place. And you can mix it up. Maybe everybody gets the same placemat and they can share their interpretation and understanding of the data. Or you could have different placemats and encourage people to share with others in the group about what they see in front of them and to start that conversation. Stephanie Evergreen, who I adore, and a link to her website is on that handout too, has some really fun ideas too for sharing data. One of them is doing scratch offs. So creating a chart or a trend graph or a table, and then putting either a scratch off sticker or homemade scratch off paint, which Stephanie Evergreen has instructions for making, to cover up that graph or chart or table, and then give everyone a penny or coin so that they have to scratch off to reveal the data. Another example of something that she's created is a fortune teller, and I'll be sharing an example of what that might look like. And then another thing that I've seen used in coalitions that I work with is embedding trivia polls into coalition meetings. So after you've gone around and done introductions, before you dive into the meaty content of your meeting, putting a poll or two up, which works well with Zoom, or if you're in a face-to-face meeting using software like Poll Anywhere, and asking a question like, what percentage of youth in our community do you think used cocaine in the past year, going back to Kristen's example, and then give people an opportunity to pick from various response options. So again, another way to just make it a little bit more engaging and interactive. So this is an example of a fortune teller that I put together for one of the drug-free community coalitions I work with. It just so happens that their coalition name is Team Epic. So it worked that in the 4 squares, I could spell out Epic. And fortune tellers, if you remember from a kid, were really about seeing into your future. Who are you going to marry? What type of structure are you going to live in? And what kind of job you're going to have is at least what I remember from my childhood. And so the way we frame this is to use this fortune teller to highlight protective factors and the change we might hope to see in the community if these protective factors are implemented. So youth who feel that community adults care about them are 2 times less likely to report past month prescription drug misuse. So if we implement strategies to improve students' perception that adults in the community care, we can hope that in the future, those youth will be reporting lower rates of use. So it's just a fun way. It's something that you could hand out at a fair or an event or parent-teacher conferences, or even in the classroom to students, so they can cut this up and fold it and interact with others. And it can really serve as a conversation starter too. So now we'd like to hear about any innovative data dissemination approaches that you've used in your community, whether you've used one that we've shared, a data party or scratch offs, or any other cool ideas that you've used. I know in the earlier chat, somebody shared an example of youth developed PSAs over radio. That's a great example. Another idea that Stephanie Evergreen shared, which is a little bit more involved, is putting data in fortune cookies, which can be kind of fun. Easter egg, cool. So was it sharing data on a painted Easter egg, or having a hollow egg that you put data in? Inside and hunting them. Oh, that's super cool. That's a great idea. And I love how that can really engage and involve youth and families in hunting for the eggs. I'm going to steal that idea, in fact. Yeah, finally getting to meet again. I know that, fortune cookies and data placemats are a little bit easier to do when we're all in person again. An Easter fortune cookie, that's perfect. Very cool. And again, we've used things like the fortune teller and the scratch offs at a fair booth or a PTA event. Scavenger hunts with youth, that's super cool. I love that idea, and having hints in the data that lead them to where they need to go, or where to find little pieces of data. Discovered the next clue, they would discover a fact. I love that idea. And I've seen communities do something similar with an escape room, where they need to identify facts and respond to them in order to get the next clue to escape from the escape room. Billboards at the entrance of the school featuring local students sharing messages. Like 70% of youth in Washington Parish have never consumed alcohol. Again, I love that idea of involving youth. I think our community members are just a lot more likely to listen if it's coming from the youth. And the youth sharing with their peers. Wonderful. Thank you so much for all those great examples. So now we want to wrap up by talking a little bit about some lessons learned from Minnesota and how they might apply for your community. So just a little background first on some similarities and differences. So very similar to Louisiana, our schools have the option to opt out of taking the survey. So we also spend a lot of time promoting and plugging the survey. Similar to the CCYS, our Minnesota Student Survey covers a wide range of topics, which, as I've shared, is really helpful for connecting the dots between our substance use prevention priorities and other stakeholders' priorities. And then also similar to Louisiana, we have an interactive searchable database that communities can use to search their county level data, as well as more static reports and some of the innovative approaches that we just talked about. Some big differences between the two surveys. And thank you, Felicia, for talking about taking that step to look through survey questions and see if there might be some that could be taken out to shorten the survey. We have 3 different levels of surveys. So one for 5th graders, one for 8th graders, and one for 9th and 11th graders. And the 5th grade survey is much shorter, and some of the questions are answered in a more simple way. So instead of asking how many days in the past 30 days they drank alcohol, we ask them if they've ever drank alcohol. And then also there are some more sensitive questions that we only ask on the 9th and 11th grade questionnaire. So it's a nice way to keep the lengths different and kind of control what's being delivered depending on the stage of development of the youth. We also have a new opportunity, which is a formal process for requesting changes to the survey. In the past, somebody could ask for a new question or a different question. It would maybe be considered, but now we have a process where individuals are asked to clearly explain why they want a survey changed or added, how it will be useful statewide, examples of how the survey question should be asked and applicable response options, maybe by researching other states that have a similar question. And then some letters of support from other communities or other organizations who also want to see that change. So it's really helped our survey team think carefully about needs over time. And we've definitely seen evolving needs related to vaping. We added a question about e-cigarette use. Now we're hearing that communities want to learn more about using e-cigarette and vaping devices to consume marijuana as well as tobacco. So just thinking about staying on top of trends and needs. And then the other thing that we've done in Minnesota recently is expanding the demographic response options over time. So on our latest survey, which was conducted in 2019, the race ethnicity response options were greatly increased. Now we have over 26, I think. So if a youth identifies as Black, African American, or African, they're asked if they're Somali or Nigerian, for example. If a youth identify as Asian, they're asked if they're Asian Indian, Hmong, or Karen. So we really dug into our American Community Survey to identify which populations were the largest in our community. And it's been so helpful to dig into differences because Asian doesn't tell you a whole lot. And we see a whole range of experiences that we couldn't identify when the data were aggregated up. We've also greatly expanded our demographic response options for sexual orientation and gender identity, which has again been super helpful, and we don't end up with kids who are in this other buckets that isn't very helpful for informing decision-making. So some steps that we've taken to promote participation in our survey. We created some one-pagers that we'll show on the next slide to help promote the survey. We're creating templates that communities can use to customize with their local data and success stories. Kristen mentioned earlier that we created a frequently asked question document. And this document has been helpful both for promoting participation in the survey by addressing concerns and challenges, but then also after the survey has happened and we're sharing findings. So going back to what Kristen was saying, you know, are students telling the truth? And this was really informed by talking with key stakeholders and finding out what their questions and concerns were. And so I believe Bev just put that in the chat. And I want to acknowledge this is a somewhat old document. We're in the process of updating it so that it's more general and doesn't name a specific survey year, so that it's something that we can use over and over. And this FAQ document really talks to questions about, again, whether students tell the truth, how representative the data are, whether or not students understand the questions, and then how anonymity is guaranteed. And then reliability of self-report data is the most common question and concern that we hear. But interestingly, in talking with community stakeholders, some people think that youth are over-reporting their use rates and others think that they're under-reporting it. So I think it can be helpful to just generate conversations. And again, going back to how we started, I think the most important way to find out what experiences our kids and youth are having is by asking them directly. The other thing that we're working on right now is a recorded webinar series. Well, we're calling it a mini series in a kind of made for TV exciting sort of way. And we're planning this for the fall of 2021 because schools will start doing the survey early, starting in January of 2022. And we wanted to make sure to not launch this in the summer when schools are burnt out from COVID and distance learning and just wanting to get into summer. So making sure that the mini series is timely and setting them up to get enrolled to participate in the survey. So the first in the series, we'll talk about kind of why and how. So we'll share examples from state level folks talking about why it's important to have the data at the state level. From one community that's been a really strong champion of our survey over the years about how they've used it, not only in their substance use prevention work, but in other work. And then just some tips and talking points for how to promote and build buy-in for the survey if a school district is reluctant. The second in the series is going to focus on how communities have used the data to address substance use and mental health. And this one is going to feature youth from a youth group who have used the data, as well as coalition coordinators, directors of youth serving organizations to try and get different perspectives. And then the third one is going to talk about how local champions have used the youth survey data to address adverse childhood experiences and build resilience. Because as I noted earlier, that's where there's a lot of energy and momentum right now in our state. So here's one example of a one-pager that we created that was specifically for school administration. And I know on the screen, this probably looks like 2-point font, but this is something that Bev is putting a link into in the chat in case it's helpful to see all the details. But the main thing is that we wanted to make sure it was a one-pager so that the school administration wouldn't be overwhelmed with what we're sharing with them. And it really specifically and succinctly gets at what is the survey? Why should you participate? What are the benefits? And then when and how to participate. A second one-pager that we put together is not for school administration, but for people who are trying to nudge their school administration. So similar to a slide I shared earlier, first asking if they plan to participate. And maybe you don't need to go much further than thanking them. But if they don't plan to participate, this walks communities through the process of getting together with other community organizations and people who rely on the data, figuring out who your champions are to carry your message forward, and then putting together a timeline for engaging with those key decision makers. And Bev shared a link to this document as well. And then I just kind of wanted to wrap up with some innovative approaches that our communities in Minnesota have used with their data. Some have used the data in classroom projects and assignments. So having students go to the state's interactive database, like the Bach-Harrison database that you have in Louisiana, and researching a topic for their community or county and putting together a report or a presentation. Also sharing the data with youth groups who are engaged in substance misuse prevention. In one community I work with, After sharing findings from the 2019 survey, the youth really got involved in an important conversation about concerns they've had with mental health and how the student survey data reflected what they're experiencing. And they were really able to elaborate more on why we're seeing some of the trends we're seeing. And just stressing the importance that these are their voices and the voices of their peers. So asking them, what surprised you? What aligned with what you expected to hear? And what are you most concerned about? And then empowering youth to share those findings, both the positive and concerning, whether it's with school leaders, having them present to a school board, or sharing the data with community groups. And you guys provided some great examples of those youth-led radio PSAs. And again, community members are just more likely to listen if it's coming from youth. We've had schools, similar to what we heard, create videos where the youth are sharing statistics from the survey and talking about why it's important to them. And then super quickly before we move into Q&A, I wanted to mention that there's a very recent 2021 research article on community-driven approaches to promoting a statewide health youth survey by Leonardo Cattardi and others. He recently delivered a webinar on this, and I believe Bev is going to upload a document of that. And we read this article after we put together today's slides, and it didn't share anything new necessarily, but it did confirm some of the strategies and approaches that we shared today. And if key decision makers in your community would be more swayed by a published journal article, it's a super quick read at 2.5 pages. So just one more tool in your tool belt. So in the last remaining minutes, just wanted to open it up to see if there are any questions that have come up.
Epidemiologist in Region 6, if you have any questions, don't hesitate to reach out to me. And we appreciate your participation in today's webinar, and we look forward to seeing you next time.